Hi, my name is Jordan,
And I'm Emily.
and we are going to be doing this presentation over isolation techniques. What is PPE? PPE is personal protective equipment. The goal of PPE is, with appropriate use, it will lead to an improvement in personnel safety. And OSHA defines PPE as specialized clothing or equipment worn by an employee against infectious materials, and it is required if there is any potential for infectious disease exposure. So what are types of PPE? As you look at some of these pictures, go ahead and try to distinguish what you think might be PPE or what you think is not PPE.
The yellow gown.
What about the sunglasses?
The mask.
Okay, so actual types of PPE are gloves, mask, goggles, face shields, and gowns. So donning and doffing PPE. Whenever you're donning PPE, you are going to start from the bottom to the top. So you are going to put your gown on first, then a mask, then goggles, and then gloves to finish. Whenever you're doffing your PPE, you're going to start with taking your gloves off first, and then you're going to move to your goggles, taking off your gown next, and then finishing with your mask. As you can see, whenever you are doffing your PPE equipment, that is going to be in alphabetical order. So that's a good way to remember it for the ATI or the NCLEX whenever you're taking that you're going to remove all of your PPE in alphabetical order. Hand hygiene. So immediately after removing PPE, you are going to do hand hygiene. And as we all know, we're going to be doing hand hygiene prior to entering or having contact with a patient at all. We're going to be using an alcohol-based hand rub when it's appropriate and when hands are not soiled. If hands are soiled, we're going to be using soap and water. And this is required for all types of PPE and all different sorts of isolations. So standard precautions. Standard precautions is a Tier 1. ATI distinguishes them between Tier 1 and Tier 2. So standard precautions is under Tier 1. It prevents transmission of body or blood or body fluids in patients with common infectious agents. These are going to include things like gloves, gowns, masks, goggles, or face shields. The disease processes that are applicable for standard precautions is just going to be anybody that you come in contact with that doesn't have a specialized isolation precaution. So it's your turn to decide. What would you wear in each situation? So whenever you're suctioning secretions from a patient, what are the types of PPE that you're going to be wearing?
Gloves, mask.
And face shields. Correct. So we're going to be wearing gloves, mask, and face shields. Whenever we're transporting a patient, what kind of PPE do we need to wear?
Nothing.
Correct. We're not going to wear anything at all. What about vital signs?
Nothing.
Correct. We do not need to wear anything when we're taking vital signs unless we expect to come in contact with any bodily fluids, in which case we're going to want to wear gloves. What about cleaning incontinence?
Gloves, gown.
Yes, so we're going to wear gloves whenever we're cleaning incontinence, and gown is just dependent on the situation. If you're going to come in contact with feces and it's a big mess, you might want to put on a gown for that. So contact isolation, moving into that is going to move into a Tier 2 isolation precaution. So you are going to be wearing a gown and gloves, and the patient is going to be in a private room, or they can also be in a room with a client that has the same type of infection. The disease processes that are under contact isolation, which is a heavily tested area for NCLEX, so make sure that you know these, are MRSA, C. diff, RSV, Shigella, wound infections, herpes simplex, impetigo, and scabies.
Next is droplet isolation, which is also a Tier 2. So with droplet isolation, you have to wear a mask when performing any task within 3 feet of the patient, and this is by the healthcare team and the visitors. And anyone in a droplet isolation will need a private room. So some disease processes include streptococcal pharyngitis, pneumonia, scarlet fever, rubella, pertussis, mumps, sepsis, or pneumonic plague. Airborne isolation is also a tier 2. So with airborne isolation, you have to wear a mask or a respirator that is specifically fit to your face. So you'll have to go to an appointment that's usually set up by your job to have them fit you with a mask for this type of isolation. Each room that is airborne isolation has to be a private room with negative pressure, so this keeps the infectious agents in the room when the doors open and close when the personnel are going in. And some disease processes include pulmonary or laryngeal tuberculosis, measles, or chickenpox.
And another thing that I have seen on ATI a lot that they like to test over is the amount of exchanges, airflow exchanges in a negative pressure room, and that's going to be at least 6 to 12 times per hour.
Protective precautions are used to protect clients who are immunocompromised, so they will have a private room, and there will be a positive airflow exchange of 12 or more cycles per hour. So this positive airflow will keep the bacteria out of the room whenever it's open or closed for the personnel to come in. And there is a HEPA filtration for incoming air. So clients will also have to wear a mask if they're outside of the room. So some nursing considerations. Isolation precautions apply to everyone despite the diagnosis, and inflammation must occur even if there is an anticipation of coming into contact with any potential infectious material such as stool, urine, any secretions. And we must remember that clients in isolation are at a greater risk for depression and loneliness. So as a nurse, we need to assist the client and their family to understand the reason for the isolation and then provide them with any extra activities to keep them entertained while they're there. So next are the ATI questions. So ATI question 1. A nurse is caring for a school-aged child who has experienced a tonic-clonic seizure. Which of the following actions should the nurse take during immediate postictal period? A. Place the child in a lateral position. B. Delay documentation until the child is fully alert. C. Give the child a high-carb snack. Or D. Administer an oral sedative to the child.
A.
A is correct. Place the child in a lateral position. The nurse should place the child in a lateral position to prevent aspiration. When using ABCs, airway, breathing, circulation, to determine priority, placing the patient in lateral position would preserve their airway.
Okay, the second ATI question is, a nurse is reviewing the lumbar puncture results of a school-aged child suspected of having bacterial meningitis. Which of the following results should the nurse identify as a finding associated with bacterial meningitis? A. Decreased cerebrospinal fluid pressure. B. Decreased white blood cell count. C. Increased protein concentration. Or D. Increased glucose level.
C.
Correct. Increased protein concentration. The nurse should recognize that increased protein concentration in the spinal fluid is a finding associated with bacterial meningitis.
ATI question number 3 is, a nurse is caring for a school-aged child who is receiving chemotherapy and is severely immunocompromised. Which of the following actions should the nurse take? A. Use surgical asepsis when providing routine care for the child. B. Administer the MMR vaccine to the child. C. Screen the child's visitors for indications for infection. Or D. Infuse packed red blood cells.
C.
Correct. C. Screen the child's visitors for indications for infection. The child who is severely immunocompromised is unable to adequately respond to infectious organisms, resulting in the potential for overwhelming infection. Therefore, the nurse should screen the child's visitors for indications of infection.
And then these are our references. This YouTube link is also on the donning and doffing page. If you have a chance to look at that video, I do recommend it. It is about 9 minutes long. However, it's really great whenever you're trying to remember how to don and doff PPE properly. Thank you.